Stepping into a dental office often comes with a familiar sense of unease. Most of us expect to sit in a quiet waiting room, mentally preparing for the sounds of a checkup. For a long time, the dental visit was viewed as a trip to a mechanic, a place to get parts tightened, cavities filled, and a quick reminder to floss more often. Today, that focus has shifted toward medical detection. Your dentist now spends the start of your visit investigating your systemic health, looking for clues in your medical history before they ever look at a tooth. This shift is driven by biology. As you can see in this diagram, your mouth is a direct gateway to your circulatory system. Blood flows from your gum tissue and the roots of your teeth straight into your heart and your immune system. We're going to step inside a few treatment rooms to see how this full-body connection changes the way you are cared for. Because the mouth and body are so closely linked, the modern dental appointment follows a completely different logic than it did 10 years ago. In our first room, a patient is dealing with a painful, swollen tooth. They've come in expecting a prescription for antibiotics to clear up the problem. In the past, it was standard to provide these pills to try and bring the swelling down before doing any physical work. We now know that the center of a dying tooth is isolated from your blood supply. As this diagram shows, antibiotic molecules travel through your veins, but cannot reach the infected center. To solve this, the dentist physically cleans the tooth, directly removing bacteria instead of relying on medicine. Antibiotics are now saved for high-risk cases, where an infection is spreading and causing a fever. This careful approach ensures you get a physical cure that actually works, while keeping these important medicines effective for everyone in the future. In room 2, we have a patient who takes daily blood thinners to protect their heart. They need to have a tooth removed, but they're worried about the safety of the procedure. It seems a difficult choice. Keep taking heart medicine and risk bleeding in the chair, or stop the medicine and risk a blood clot. Current medical advice is clear. Do not stop the heart medication. A blood clot in a major vessel is much more dangerous than minor bleeding in your mouth. Your dentist manages the tooth site directly. Using specialized packing materials and small stitches, they seal the area to stop local bleeding, keeping your heart protected. This approach shows how dental surgery is now carefully coordinated with a patient's long-term medical needs. Our third patient is an expecting mother. She's considering canceling her appointment because she's worried that any dental work might affect her baby.
It's a common concern, but avoiding the dentist during pregnancy is actually one of the biggest risks you can take. Pregnancy causes a massive shift in hormones that makes your gums much more sensitive to bacteria. As you see here, this can cause the tissue to swell and bleed, while morning sickness can wear away the protective surface of your teeth. If these infections are ignored, they can travel through your body. Doctors have found a strong link between untreated dental issues and babies being born too early or with a low birth weight. Routine cleanings and necessary treatments are completely safe and are a vital part of staying healthy during pregnancy. Looking after your mouth is an essential step in looking after the health of both the mother and the child. In our final room, the patient is feeling very anxious. They are worried about the pain of numbing medicine and the fear of something going wrong during the treatment. To handle this, modern clinics use computer-controlled systems that deliver numbing medicine at a very slow, steady pace. This allows the medicine to work without triggering your pain receptors. There is also a quiet safety system in place. By checking your vitals and understanding your medical history beforehand, the team can predict and prevent most complications before they start. If a rare emergency does happen, the office is equipped with oxygen and follows strict medical protocols to handle things like fainting or asthma attacks immediately. The modern dental chair is a highly controlled space where your physical comfort and medical safety are the top priorities. Every detailed question your dentist asks about your health is designed to ensure that the treatment they provide is safe for your whole body. This is why it's so important to be completely open on your medical forms. Let them know about every medication you take and any health changes you've experienced.
We can move past the old fears of the dentist once we realize how much the technology and the medical standards have advanced. Your dentist is a key member of your medical team. When you're in their care, you can feel confident that they are looking out for your health from head to toe.